Hello everyone, good evening. We are back with yet another episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I am Jessila Mujib. Influenza or flu is a common illness in this weather. The symptoms may be mild or severe and sometimes they may lead to complications. To discuss this topic in detail, we have with us Dr.Ameera Ameer Abdullah. She is a general practitioner from AL-HILAL Hospital, Muharraq. So, to throw more light to the topic, let's move on to the doctor. So, doctor, welcome to the show and thank you for being with us to discuss this relevant topic.
Thank you.
So, doctor, let's begin by discussing the symptoms of flu. Please explain the symptoms of influenza or flu for our viewers.
As you mentioned, influenza can come with mild symptoms. These mild symptoms may be body pain, fatigue, tiredness. It may progress to some sore throat, mild cough, runny nose. And then also it might be moderate, like severe, like moderate to severe, which is coughing, fever. The fever comes in a high temperatures, cough whether it's productive or dry, throat irritation. Mostly these are the symptoms.
So, doctor, now you explained about the symptoms. So, can you explain the causes of flu for us?
Okay, so as the word flu comes, it comes from the word influenza, and influenza virus is the common cause of flu, especially in this weather. We have 4 types of influenza virus: A, B, C, and D. Most common causes is actually influenza A and influenza B, which comes under them so many subtypes of influenza like H1N1, all of these. Actually, these are the common causes of flu season or influenza in general.
So, doctor, how was this flu spread?
Okay, so as most of the viruses are, flu spreads by airborne. Okay, so sneezing, coughing, sputum, all of these things will help to spread the infection. And spreading the infection can be by touching infected object or holding infected tool, using someone else's personal stuff, or getting exposed to these or airborne particles that help to spread.
So, touching the things that another person who had flu, we will also?
Yes, if you did not take proper hygiene after that, yes, mostly you will have it.
So, how long is a patient contagious to spreading this virus?
Okay, so approximately incubation period is around 2 days, but it can ranges from 1 to 4 days generally. That may last up to 5 to 7 days. But generally it's 2 maximum to 4.
Okay. So, once a person comes to you for treatment, what are the treatment options you go for? Or will the flu go away on its own? We have to seek medical intervention?
Again, according to we categorize flu to mild, moderate, and severe. So for mild flu, just rest, good hydration, good fluid intake, person might recover. But if the symptoms progress or the person feels that he's still feeling weak or still experiencing something, discomfort, we can go for symptomatic relief. Mostly for any viral illness, we go for symptomatic relief. So symptomatic relief means if a patient is having fever, we will go something to lower his fever. We'll give something to lower his fever. If he's having cough, according to the type of cough, we'll give something to help with that. The throat irritation, runny nose, each symptoms will be treated individually to get rid of this till the virus gets eradicated from the body. For severe cases, we might use antiviral treatment. Now, like for this season, this flu season is a bit heavier than other seasons. So many practitioners will start using antiviral for those who is not responding to these simple measures.
So, doctor, can you explain the complications of flu for us?
Okay, so as we said, if its symptoms is not responding to treatment and all, it might actually progress to the complication we're not hoping for. Common complications are pneumonia, pleural effusion, some breathing difficulty, chest discomfort. All of these things requires immediate medical care and seek an emergency.
Okay, doctor. Now, what about the flu in children? How to deal with it?
Flu in children is actually heavier. It was found that 90% of death because of fever or flu season are among kids who are less than 5 years. So again, treatment will vary according to the severity of the flu. For mild symptoms, we will have to give, as we said before, symptomatic relief. But if it progresses or still going as a severe infection, we will start to give antiviral. In children, most importantly, we have to monitor baby's activity, baby's hydration. And if any of these compromised, then definitely we need to seek medical emergency. Also, we would check the labs for any signs of bluish discoloration, grayish discoloration, difficulty breathing as an adult. All of this requires immediate medical intervention.
Okay, so we should be very careful when children are having.
Yes, definitely.
Flu.
Yes, even with the fever.
Okay. Normal
Kids
fever.
If the fever is too much high, baby is not responding to treatment, that may precipitate something called febrile seizure, which is a seizure that accompanies a fever.
Okay.
If not treated, that could be turning to really serious complication or life-threatening, as we call it.
Now, I would like to know who all are prone to flu frequently. Any specific conditions for that?
As we said just now, kids younger than 5 or kids in general will have low immunity. So any person with a low immunity, like people with chronic medical illness, hypertension, diabetes, sickle cell patient, or patient who are immunocompromised, like the one who is taking chemotherapy, radiotherapy, hormonal therapy. Who else? People who works in a crowded area, like schools, children's school students, healthcare workers, industries, any restricted area. Any person with a flu might spread the flu to the whole area. So
in the crowded area, we should be careful. So another query is, can we prevent flu?
Definitely. Most actually of illnesses, there is a prevention way. Okay. So most importantly, as we said, in any viruses, as we have in COVID, good health, good hygiene, hand hygiene after holding any object, whether we don't, because mostly we don't know if it's infected or not. Avoid touching your hand or face while your hand is dirty. Maintaining proper fluid intake or maintaining a healthy lifestyle with proper exercise, good meals or good meal planning, that all will help to prevent. Lastly, we have the flu vaccine that also helps to prevent having flu as a person.
Okay. So can you please explain the difference between bacterial infection and viral infection?
Okay, so as we said, flu comes from the word influenza, and influenza is a virus, and usually the virus is subsided by their own, mostly in majority of the cases. While bacterial infection requires antibiotic will not be working in a flu or an influenza infected person. This is the main actually area, like most of people will come asking for an antibiotic in that status, and that is not required because basically the antibiotic does not have any role in treating any viruses.
Viral infection.
We might use antiviral treatment for the flu only in severe cases, or that person who's not responding to normal measures or symptomatic measures.
Okay, now you mentioned about the flu vaccine. Our viewers would like to know more about flu vaccine, and is it necessary to take it every year, and is it effective?
Okay, so the main medical prevention of a flu is the flu vaccine. Flu vaccine is taken once per year, okay, and anyone can take it, like even kids and children can take the vaccine. Why it's given every year? Because, as I said before, we have so many types of flu. So whatever is the suspected influenza virus we're gonna have this year is being given as a weak virus, and this weak virus will build your immunity. So basically you're injected with a live weak virus that will help your body build its own immunity, and by building the immunity, whenever you're having the flu, the real flu season, you'll be prevented, or even if you have it, you'll have it with this minor symptoms.
Okay, any side effects for the flu vaccine?
It's a vaccine, it's a virus, okay? So it's like having the virus, but with a weakened power. So less likely to have any side effects, no.
Nothing like that. Okay, doctor, now you have explained about the flu vaccine and symptoms and all. Any advice for our viewers about this topic or any other related topic for a healthy lifestyle?
See, our body is built by what we eat, what we do. So maintaining a healthy diet, maintaining good exercise or physical activity will have a better immunity. That not only will prevent us or will give us good immunity, but will prevent us from having any sort of illnesses. And with this, I think we can manage to have better lifestyle also. AL-HILAL Hospital, with all its branches, had made sure that flu season goes smoother to you, your family, whether they're your kids, or your parents, your elder people, or your immunocompromised. AL-HILAL Hospital provides 24-hour services and has the flu vaccine available in all of its branches, and the antiviral if, God forbid, anyone needed.
Thank you, doctor.
Welcome.
Thank you for being with us and discussing about the flu in detailed manner. Thank you very much.
Welcome, dear. Welcome. Thank you for the opportunity.
So viewers, I hope this episode was helpful for you. As doctor advised us, proper hygiene and a healthy lifestyle will help us to manage this flu season. See you all in yet another episode of BMC Global Live, AlHilal Health World, Nothing But Lifestyle. This is Jasila Mujib signing off. Good night.